You wake up and join the team. It's good to be a part of Wake Up. Wake up, join the team. We will see you in Jesus' name. God bless you.
In local dia. In Latin, local dia means this is the house of the Lord. In local, passway every calavera. This is Psalm 123. The Lord is my shepherd. This is Dr. Smith from Warrior Family Ministry. Loving on you all y'all again. May God bless you.
This is Pastor Neil of the New Covenant Christian Faith Church Ministries, 5427 Murchison Road, and I am proud to be a member of Wake Up.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome back to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. As you know, October, Breast Cancer Awareness Month. So today we're talking breast cancer awareness. We're talking early detection. We're sharing testimonies and stories and the whole nine. And we're doing this with physician assistant Hunter Hudson today and breast care navigator Erwin Champion. They are both with Cape Fear Valley Health's Breast Care Center. Now, ladies and gentlemen, because of what we're going to talk about today, remember, this program is for self-diagnosis. This is not this program is for informational purposes only. This is not a time for you to self-diagnose, especially with what we're going to talk about today. So if you suffer from anything that we may discuss, or if you have a loved one that may suffer from anything we discuss today, do me a favor. Find yourself a healthcare professional. Now, ladies and gentlemen, on today's broadcast, we have Ms. Erwin Champion. Erwin is the breast care patient navigator for Cape Fear Valley Health. Basically, what she does is she holds the patient's hand after they're diagnosed, and she walks them through the process. And she has a testimony of her own. Then you already know I'm going to ask her to share it. Also, we have Hunter Hudson with us today. She is a high-risk clinic provider. Now, what Hunter does is she works with the patients who have an increased risk of developing breast cancer in their lifetimes. Now, ladies and gentlemen, let's welcome back to Making Rounds Live, Miss Erwin Champion. And first let's go bring in Miss Hunter Hudson, excuse me. Hunter, first of all, welcome back to Cape Fear Valley Health's Making Rounds Live, lady.
Thank you, I'm glad to be here.
All right, early detection is the key to so many health issues, and early detection has saved my life, excuse me. That little frog. And it saved my life. And for those of you that don't know, the way that my story started, and we were sharing earlier, is my story actually started before my actual symptoms started. Because the way mine started was that I was getting my hair done that day, and my stylist, she noticed that I had long strands of hair coming out. And she says, Omega, you have something going on internally. You need to go to a doctor. Well, I didn't pay any attention. And so afterwards, that's when I started feeling these funny sensations in my left breast. Can't really describe it. It was just a funny sensation, to the point to where I was walking around cradling my breast. And that's when my late husband was like, Omega, that's not normal. You need to get it checked on. I went to Dr. Albanius Tan, and Dr. Tan says, you may have breast cancer. And I'm like, of course, I went to medical school. I don't have breast cancer, Dr. Tan. It doesn't run in my family, and I haven't had the lumps and the symptoms. She said, go get a mammogram. It took me about 6 months before I got that mammogram, y'all. And then when I finally got the mammogram, they found 6 calcifications in my left breast of my nipple. Then they sent me back for a a more detailed mammogram. I can ask Aaron and Hunter the real name for it in just a minute because it's left me right now. But then, sure enough, that came back and I had breast cancer. And then I was told those words that no one wants to hear, and the rest is history. But I went in to say that early detection, it saved my life, because when I was diagnosed, it was in the early stages, and Martina Navratilova and I were diagnosed with the very same thing on the very same week. So let me bring Hunter in. Hunter, I said all that to say early detection is important. Getting those screenings in is important. The key word is regular. Every year, once a year, why do we need to get those screenings and those mammograms?
So average risk women that start mammograms, they need to start mammograms at 40 years old, and they need to get that mammogram, just that screening mammogram, once a year. The very important reason for that is our only screening tool that we have for average risk women to detect breast cancer. It's actually the only imaging tool that we have that actually decreases mortality rate of breast cancer, and that's due to our ability to find that breast cancer as early as we can. If we are waiting multiple years in between mammograms, that's giving cancer, potential cancer, time, and time is only cancer's friend. We do not like to give time to that if we do not have to, and once a year screening mammograms are the only tool for average risk women to detect breast cancer.
All right, Hunter, what if someone got a mammogram, let's